Welcome to another episode of The Candid Savage, episode 6, where we are talking about cannabinoid therapy. On the call today, I have François Hallé, who's the co-founder of the Clinical Cannabinoid Consulting Group, has over 5 years experience in dealing with cannabinoid therapy. And the reason for me bringing this on to The Candid Savage is not because it's going to become legalized in Canada in the near future, but because it has done so much good and positive for people who are fighting illnesses and chronic disease, and other things like PTSD, which is huge these days. So I wanted to bring on an expert in the field to talk to us about cannabinoid therapy. Everyone, I want to welcome François Hallé to The Candid Savage.
Thank you, Ashley. My name is Dr. François Hallé. I'm a medical doctor by trade. Been involved in cannabinoid treatment for close to 5 years now, a little over 5 years actually. And my original passion was pain management and palliative care. And I served myself. I'm a veteran, so I had a lot of friends that kept on serving and ended up with a debilitating medical condition called post-traumatic stress disorder. I lost a couple of my friends to they ended up ending their life prematurely. And the ones that did not were on cannabinoid therapy, got me extremely interested in the why. And this is one of the reasons why I got involved with cannabinoid therapy. And since then, just been working my way through this and developed treatment plans based on milligrams of cannabinoids per day for individual medical conditions. And we'll go over the basics of cannabinoid therapy together today.
Yeah, I'm excited for it because there's such a big stigma with, we'll use the term marijuana because that's how a lot of people know about the plant. And there's a huge stigma. And like my background, and I should say family's background too, because my dad was a police officer. And then myself doing stuff in terms of, grow operations back in my day. There's a lot of people that still have this negative view on marijuana and don't understand the actual great health properties that it has. And one of the big questions I get asked whenever I want to touch on the topic is, well, how can you function? I mean, you're going to be high all the time. So there's that, that negative connotation where if you smoke a joint, you're going to get high, but that's not at all what this is. So I think the one thing that we should discuss is the big difference between the basics of, THC and CBD.
Yep, and that is really important. And I think one other thing that we should maybe demystify first is the two sides of the coins that we're seeing right now, right? So we're talking about marijuana becoming legal in 2018 on July 1st. Well, you got to remember, for medical purposes, marijuana was since the late 90s. Authorized for a medical person or a person with an illness to be able to utilize marijuana for medical purposes. And now the only difference is that we're talking about recreational, which is completely different, as you outlined. So cannabinoid therapy has nothing to do with smoking a joint. It's literally taking a medicine which happens to be from a plant. And you got to remember, a lot of our medicines that we are currently take originally came from plants. And I'll give you the best example of them all. The oldest medicine that we have is ASA, or aspirin. Well, aspirin comes from willow trees. This is what it was. It was a willow tree extract. And then that was good for inflammation, kept people away from having too much pain and decreased fever. Then we discovered the active component. It's about the same with medical marijuana or cannabinoid therapy. We use active components inside, and it has nothing to do about the smoking. Now there's 85 different cannabinoids that are produced by the marijuana plant. Out of those 85, we identified about 5 of them that have very good medical purposes, but the main 2 that are yielding a whole lot of interest is the one that everyone knows, delta-9 THC, which is also responsible for the euphoric or the high effect of the marijuana. And the other one is CBD, or cannabidiol. Cannabidiol is extremely interesting because it binds to two types of receptor. We have what we call the endocannabinoid system in our body, and we have two types of receptors on that endocannabinoid system. The CB1 receptor, which we mainly find in the central nervous system and on the nerve cells, some little foci here and there outside of the central nervous system. But the CB2 receptors are found outside in the periphery, mainly on your immune cells, on your gastrointestinal cells, and all of these. So this is what makes CBD so interesting, is that it can bind to both of them and have very potent medical effect without any impairment. It does not cause euphoria, no psychoactive effect. This is why we've all heard about Charlotte's Web. Charlotte's Web, well, it comes out, the name comes from a little lady, Charlotte, that had intractable seizures. She had Dravet syndrome. And her parents started to use CBD oil, which was an extract from hemp. And basically, she stopped having her seizures. And this is one of the reasons why it became so popular. And that's, in the last 5-10 years, more research was done and we understand even more. We didn't know back then that we are producing cannabinoids. You produce cannabinoids, and I do. We produce two main ones. One is anandamide. That's the one that predominantly binds to the CB1 receptor in our brain. Mm-hmm. And it's the one that plays a role in post-traumatic stress disorder. And it's a lookalike to THC, which is very interesting. And we produce another one, which is 2-AG or 2-aminoglyceric acid. 2-AG is easier. And this one binds to the CB2 receptors predominantly in the periphery on your immune system as well. So the endocannabinoid system is responsible for the homeostasis, meaning the steady state. Yeah. What's really interesting about the endocannabinoid system, when I went through medical school, we didn't talk about it because we didn't know it existed. We knew that THC would bind to a receptor in the brain. We knew it was a G-coupled protein. And we knew that some of those receptors were found in the basal ganglial system and in your cerebellum. And this is what caused the impairment, the INN coordination mismatch and the euphoria. That's all. Now, as things have progressed, as we've discovered more and more, we've realized that, it actually plays a role. So by homeostasis, what it regulates, an hyperactive system, regardless of the system, we'll use the immune system as an example because it's easy. Someone that has an autoimmune disease like rheumatoid arthritis, their immune system is overactivated. By being overactivated, what it does, it actually causes the person's own immune system to attack your own endogenous proteins. Now, when that endocannabinoid system is stimulated, it brings it down. So one of the reasons why we do not, the person that is affected by rheumatoid arthritis is because they're not producing enough 2-aminoglyceric acid that would put the breakdown on their own immune system. So what we do is by adding CBD to their daily regimen, we are able to decrease the intensity, severity, and frequency of flare-ups of those rheumatoid arthritic crises. Mm-hmm. And then again, an underactivated system would be reactivated by the stimulation of those receptors. That's what it does. It brings the system back to the normal state.
So that's like, I have personal experience like with family members and then also people that I know and so on and so forth that are using either THC or CBD for stuff like Crohn's, so gastro issues, and also people that have trouble sleeping, so insomnia, they can't sleep. And some people will ask, okay, well, if, I have Crohn's disease, what is the best form, like a topical, a pill, or a vape, which a lot of people use as well? Like, what is the best form for them versus, say, someone who, we'll say anxiety, because a lot of people are suffering from anxiety and depression. So if someone, is smoking that joint or taking something with high THC, they can't function at work properly because they'll be high, pretty much is what people think. But if they take something like CBD, it doesn't give them that high.
Not at all.
So how would you tell someone if they're having, say, Crohn's disease or anxiety, how would they find out what to take? Because a lot of people will walk into, I won't name the stores, but they'll walk into some places and they'll take something that doesn't work. So how can they go about getting the right stuff?
Well, first off, let's go over this quickly. All of those stores, okay, the dispensaries that we see, they're all illegal. It's literally glorified drug dealing. To be quite honest, they're not regulated by Health Canada. They have no right to be open. The only legal way to obtain marijuana for medical purposes currently is through a licensed producers. Those licensed producers, there's now 74 of them that have licenses. Out of this, there's 26 of them that are currently dispensing to the Canadian public. They're the only ones that are allowed to grow, make the extracts, or and sell the products back to the
with super strict guidelines too.
Exactly. It's just as strict. Actually, let me rephrase this. It's more strict than what you see on the pharmaceutical side of the industry. It's everything is tested. They can't even it can't even budge by more than 0.1% on the amount or concentrations of the cannabinoids that are labeled on the products, and they have to go through extremely strict guidelines. Now, when you go to a dispensary, nothing is tested. And there was this news article that was on the National Post about 2.5 or 3 months ago now. They tested dispensaries across the country, and they found that 80% of the product that they tested was either contaminated with banned pesticides, with molds, which can cause severe lung issues, just so you know. And
especially if someone has a pre-existing heart or health condition that's going in to get help, and they're taking it, probably going to make it worse.
Exactly, and this is why those dispensaries, and then some of the gummy bears were actually laced with fentanyl, which is huge.
What?
It's yes, and you know, it's when we were reading this, to me, I was not surprised. I knew that because you don't know where that comes from. Well, it is still the black market, right? Yeah. So it's the same stuff that used to be sold at the corner of the street, right? Now they just have suits,
a storefront.
Storefront. It doesn't make it legal.
Yeah.
And but to go back to what we were saying about what's the difference between, you know, smoking that joint or vape. So let's say we'll use Crohn's colitis as an example. Person that does have Crohn's, that is in an active flare-up, this person will not be able to take oral oils or extracts because it's not going to absorb anything. So at that point, what we do is we have the person vaporize. Not smoke, but vaporize. There's a huge difference. Mm-hmm. When you do smoke, it's too high of a temperature. You destroy about 88% of the medicine. And on top of that, anytime you heat up a organic compound over 1,000 degrees Celsius, you start to produce what we call aromatics. Those aromatics are carcinogenic, and they also cause lung parenchymal destruction. In plain lame terms, it leads to COPD or to emphysema. So we do not recommend smoking. When you vape, it's just the right temperature to activate the product, which is around 360, 380 Fahrenheit. And it's a vapor. It's not a smoke. Mm-hmm. So you don't have those aromatics, and 85% of those cannabinoids are activated. So there's a 7-fold increase on the potency or on the active components the person is going to be able to inhale. This being said, 7 times less use or less product to be used for the same effect.
Yeah.
We use CBD predominantly in someone that does have Crohn's colitis. And the reason why we use CBD, Crohn's colitis is autoimmune disease. So what we're trying to do is to moderate or modulate the immune response to their own cells, or gastrointestinal tract. And in this case, once the person starts vaping and you vaporize, you know, every hour and a half, because when you do inhale the product, it's short acting. Mm-hmm. It acts really quickly within 5 minutes, but after 90 minutes, the effects are gone. So every 90 minutes, the person will vape. And after about 10 days, the person flare up is going to be gone. Then we can start the real treatment plan, because the treatment plan is based off oral intake. It takes longer to start acting, about 45 to 50 minutes, but it gives a consistent, continuous relief or action or activity for 4 to 6 hours. So we typically give an oral dose with breakfast, another one with lunch, another one with supper, and another one an hour before bedtime. In between those dosages, if there's any flare-ups of of anxiety or whatever we're trying to treat. And in this case, let's say the person does have breakthrough pain from cramping, then he can vaporize. It's going to give him that immediate effect that is going to be short acting. And remember, if we are just using CBD, there is no psychoactive effect.
Yeah.
If you want to talk about something else like anxiety or PTSD, what we need to do is to replace the anandamide in the central nervous system that is no longer being produced. This is when we need to introduce THC even during the daytime. Now, how can this person not be impaired being on THC?
One of the biggest questions.
Yeah, well, we can. What we do is we have to titrate the dosages over a long period of time. It's kind of like if I would have to put you on some opiates because you're in a lot of pain because you have a compound fracture of your femur. Well, if I give you a large dose right away, guess what's going to happen? You're going to fall asleep. A week later, I'm going to give you that same dose, and you're no longer falling asleep. Pain control is still there. A week later, then the pain control is no longer there. You're definitely not tired because you got upregulation of your receptors. What's interesting about medical marijuana or cannabinoids, in the case of THC, basal ganglial system as well as the cerebellum, this is where the euphoric effect and the impairment will occur. What we see is tolerance being built over time in those areas, but in the limbic system where we're trying to increase the amount of THC to replace the anandamide, there is no tolerance being built. So we still have the medical effect without the impairment. So this is why it needs to be done through medical facilities with specialists, trained cannabinoid educators that are medical professionals and under the supervision of a doctor, in order to be able to titrate and tailor those dosages and be able to increase the tolerance and increase the dosages in order to achieve our therapeutic range without having the person completely impaired.
Yeah, and I think that's one of the biggest stigmas too, is people are saying, oh, if we legalize marijuana, people are going to be at work and they're going to be high. But that's...
I'm actually worried about that, and you're right. This is what's going to happen, but it's on the recreational side of things, right?
Yeah.
Not on the medical.
Yeah.
What I'm more worried about, when I was advising on that task force, I was an outside advisor, and I was the only one against it. They looked at me like I had four eyes. I don't think we have that framework in place because all of those clients that we've been helping for the past, 5 years, will be penalized because of that. Now, what's impaired driving? What is all this? Like, how are we going to be able to manage this? Now, the person that has severe PTSD, with what I just explained, that has been taking cannabinoids for 5 years or for, let's say, 2 years, if we take a blood test and see how much THC he has in his blood, he's going to bust through the roof.
Yeah.
But he's not impaired. Now, if you're talking about that 19-year-old kid that is going to smoke a joint, he's going to take 3, 4, 5 inhalation of that joint, going to take his car, he's going to be completely wasted / impaired because he didn't build that tolerance, because it's not even on the medical side of things. And you don't want to build a tolerance when you're talking about recreational, right?
Yeah.
So the employers now, they ask a lot of questions, and my answer is always the same. What would you do with an employee that shows up to work drunk?
Yeah.
It's the same. Now, the person that has medical marijuana is not going to be impaired because, or at least if it's done appropriately, everyone can abuse any type of medication, whether it's a benzodiazepine, whether it's an amphetamine for ADHD.
Yeah.
I mean, people will abuse them. Now it's for the employer and the HR department to recognize those signs and assess whether or not someone is impaired. Because this is what we need to know, whether or not the person is impaired. Is the person able to function and be able to go to work and perform their daily tasks? This is what it is. Now, you can abuse any type of medicine. Some people will abuse their amphetamines for ADHD. Some people will abuse their benzodiazepine that are prescribed for insomnia or for anxiety. And it's just as bad. Now we're having this discussion regarding marijuana because historically speaking, it was used as a recreational drug, right? But if we date back in history about 5,000 years ago, we have evidence that the Chinese would use it in a tea form in order to treat arthritis, impairment due to old age, which is most likely a dementia, as well as pain control and as well as fever and for malaria. Now, if you think about this, these are all secondary to the overactivation of the immune system or pain itself, because both CBD and THC really have a big role to play in treating pain.
Yeah, and I think like I talk to people that I know either in the clubs or on the street or through social media that have PTSD, and I know that that's where your passion lies too, is with PTSD and helping people with that. Now, how can we kind of like, I don't want to use the term dumb it down, but I'm going to use it. How do we dumb it down to help educate people on why cannabinoid therapy helps those with PTSD?
Well, let's talk about PTSD first. What is PTSD? Well, PTSD is a survival mechanism. It's a survival tool. Biologically speaking, this allowed us to survive. To see your neighbor being eaten alive by a saber-toothed tiger, or to being attacked yourself by a saber-toothed tiger. Next time you would see, hear, smell anything that would resemble a saber-toothed tiger, your fight or flight had to kick in. Mm-hmm. If not, then you were not to survive, right? So that biological pressure created that. How does it work biologically? Well, we have a part of our brain called the limbic system. This is where we integrate past memories, our surroundings, whatever we see, we smell, we hear, we taste, into present thoughts, and we make a rational thought through this. I'll give you an example. You walk into a place and it smells like garlic tomatoes. You're like, oh my God, grandma used to make one just like that. It smells like grandma, and you feel happy, right?
Yeah.
That's mediated through anandamide, which is a cannabinoid. Now, to be able to integrate your past memories with what's happening right now and formulate that thought is all modulated through this. Now, after you've been exposed to a traumatic event, okay, or repetitive traumatic event, or repetitive hypervigilance episode, let's say you were deployed as a soldier and you're always on hypervigilance mode. Mm-hmm. What happens is that you stop producing anandamide whenever there's something in the environment that resembles that original place you were where those traumas occurred. And it's biological survival tool. It's your fight or flight. You need to get out of there because you're in danger, right? This is why. This is what happens. So the person that has been deployed, we'll use a veteran as an example because everyone understands this. You would be walking on the side of the street. There would be a little bush there and a twig is sticking out. You won't even notice it. If you do, you might even think, oh, little cutie bird might go on it. Yeah. But for someone that was into a war zone or was exposed to that hypervigilance mode being deployed, not even noticing the thing, he's going to start to have a trigger. Why? That looks like an enemy antenna. He doesn't even have the ability to understand what just happened. It's fight or flight right away. This is why they get into those hypervigilance crises or panic attack and anxiety. They feel cornered. Everything goes bad. Now, what we do with cannabinoid therapy, we just replace the anandamide that is no longer being produced when those triggers occur. So by giving them a constant dose of THC and CBD, but the THC binds to the superior amygdala is exactly where it binds in order to be able to process everything the same way they used to before their trauma. So it allows them to take part into their psychotherapy, exposure therapy, neurofeedback, biofeedback, all those other types of therapy in conjunction with cannabinoid therapy, extremely successful. The person is able to process the information almost the same way as he used to before that trauma. This is what it is, and this is why it works so well. Now, what do? We give these guys CBD during the daytime at first, and then THC just at nighttime, because yes, it does help fall asleep and stay asleep. Takes care of the nightmares as well for them, because, well, even though there's no anandamide, THC kind of replaces it it's a look-alike. So it replaces it for a while, and then during their sleep, so they're not going to get those nightmares. So they get better sleep. They actually are less anxious the next day. Plus, the CBD, as it binds to the CB1 receptor, is a very potent anxiolytic. So it helps with their anxiety. We do this for the first 28 days. After 28 days, then this is where we start to introduce the THC during the daytime. We give them dosages of the CBD, but also what we call one-to-one, a little bit of THC and a little bit of CBD in conjunction with their original treatment plan. And if they have any kind of flare-ups of anxiety or hypervigilant crises, this is when we have them vaporize a one-to-one ratio, which is THC and CBD, to have that immediate effect, to break that circle and be able to go back to reality and not being completely out of her and being extremely anxious and not be able to perform their daily tasks. Yeah. So what we see, people returning back into community and being active in the community, because this is all they want. Everyone who's affected by PTSD, all they want is to get their life back. This is not the ultimate solution. Don't get me wrong. There is no silver bullet. It does not exist. There's no fountain of youth. It does not exist. In the case of PTSD, does it work really well? Absolutely. Is it the only treatment plan? No. It needs to be used in conjunction with everything else. It's not a solution on its own. But we're doing so much better now that we understand the mechanism of action of the cannabinoids, the endocannabinoid system, as well as the cause of post-traumatic stress disorder. Now it allows us to literally take a step further and have these people reintegrate their family, their fathers again, their sons again, their spouses again. And it's magical to see what we can do, not only with the cannabinoid therapy, but with the real full treatment plan.
Yeah. So the treatment for PTSD, is it similar to how you would treat someone with depression?
No, not at all. Someone that has depression, basically, there's various types of depression, and the one we typically see, or the cliche, is the type where the person is always sad, where the person does not have any interest in anything anymore. And most of the time, depression is due to it starts as an adaptation disorder. There's something that happens, you're not able to deal with it, and for some reason that the full mechanism or biological mechanism we don't understand. But the bottom line is you decrease the production of serotonin in your brain, in your reward system. Why? Not 100% sure. So what we do is we give them SSRIs most of the time, which are selective serotonin reuptake inhibitor, in order to allow higher levels of serotonin in the synaptic cleft or in between the neurons, in order to have the full reward system or pathway to be reactivated. And the hope through this is that the person gets back into their daily activities in a regular way, without having all of the symptoms that we just described, whether it's person is not able to concentrate, person doesn't take interest in anything, and so on and so forth. That's the goal, that's the hope. And to be quite honest, it works very well, not on its own. You need to do it in conjunction with psychotherapy and so on and so forth.
I think that's important to note as well, is using cannabinoid therapy, I always screwed up. Cannabinoid therapy is always in conjunction with other therapies. So a lot of people think that, having a vape or having a pill or having the ointment to deal with PTSD, depression will get rid of everything else. But this is just another tool in the toolbox that you can use amongst the other stuff that you're using. And I think that's a super important point to make to people, because some people think, I can take this and I don't have to do anything else.
Right. And a lot of times we hear that, I just don't want to take those pills anymore. So no, we got to be careful, especially with seizure disorder. We have this all the time because, of what we've explained earlier with Charlotte's Web. There's no such thing as a silver bullet. Yes, we do have very good success with CBD oil on its own. Do we need to do more research? Absolutely. We have good evidence right now. There's a lot of statistically valid data out there. Are we missing some? Oh, absolutely. we're part into research projects. We're in the midst of doing a few calls for proposals. There's a lot of potential for a lot of the cannabinoids, and then we need to understand how it works. What are the actual dosages? Like the treatment plans that I've, that CCCG has developed is based on current literature in the world. Mm-hmm. So not only here in Canada, but also in Europe, and then in other parts of the world where we have been using cannabinoid therapy for a while now, and also current practices. And we've created a roundtable of subject matter experts to put their 2 cents into this. And we're really close to what we think would be optimal dosages. Now, will these treatment plans be changed? I hope that they will, evolve through time. Yeah. And then as we find out more and more about the usefulness and sometimes the unusefulness of cannabinoid therapy and drug-to-drug interactions, don't get me wrong, it's not because it's from a plant that it does not have an effect with something else. There was a very good example that we've known for like 20 years. St. John's wort tea, which is the #1 line of treatment in Europe for the blues or adaptation disorder, which is the precursor of major depressive disorder. So we use St. John's wort. Now, if you use this and you happen to be on a beta blocker for your heart because you have hypertension or you have arrhythmia, it can actually trigger a fatal heart arrhythmia. Well, it's from a plant. Well, it's not because it's from a plant that it's
still medicine.
If it's active, it's active. And there's a potential for drug-to-drug interaction. You got to be careful.
That's like people mixing prescription drugs and then watching a TV show and then going out and buying supplements. And then they cross the medication they're on and then they run into some trouble. So
exactly. Absolutely. And I'm sure that you've heard many stories in your own life about people, even with natural supplements, taking 2 different natural supplements that can counteract each other, or even have like a synergistical effect, which can trigger various things.
Yeah.
How many times do we have someone that has intractable diarrhea that is secondary to dietary supplements that they are taking, and people don't even have the reflex to disclose this to their doctor? So are you taking any medicine? No, not really. And then when you dig a little and you're like, yeah, but you're taking devil's claw for pain, you're taking, and you add the list, and sometimes I'm like, I'm no pharmacist, but I think there might be potential for drug-to-drug interaction somewhere in there.
Right. Yeah. One of the other things too that I was asked from my followers, one of the women had asked, how does someone know, like, what is the difference between the indica and the sativa? And we know that if someone takes, say, like an indica and it doesn't sit well with them, there's a reason for it.
Most people that do have issues is more with the sativa. And the sativas are known to give the more uplifting or creative type of euphoria or effect. Okay, so someone that has been on cannabinoid therapy for a while, that is on THC during the daytime, we tend to give something that we call a sativa dominant, because it doesn't give you that drowsiness effect that you do find with the indica. Okay. Just a good way to remember this: the indica puts you in that couch. So it's the marijuana that typically will, on the recreational side of things, when people did try, sometimes they say, oh, I don't know, I smoked some pot and then just didn't feel good. I was all anxious and my heart started to go up. My thoughts were just all over the place. That's most likely to be a sativa dominant. Now, the indica is the one that when the person uses it, sits on the couch, watches TV, and eats a whole fridge, right? So that's the indica. Now we don't typically see like full sativas and full indicas anymore. They're more what we call hybrid. And the dominance, during the daytime, we're looking into a sativa dominant, and most of the times you're going to look at like 60% sativa and 40%, which refers to the genotype, right? So it's not a full sativa. It does not have that full uplifting effect, and it allows the person to be able to have their dose of THC once the tolerance has been built up without, having all those effects. And there's a lot of cases where we try to refrain to use sativas, and I'll give you an example. Someone that does have post-traumatic stress disorder or generalized anxiety disorder, and they are on a sativa, it can trigger panic attacks because the heart rate goes up, and then the thoughts are starting to race, right? And if you already are fragile on that side of your life, then your likelihood of being into a full-blown panic attack is greater, right?
Which
is why we try to refrain to use them. But the main difference, plant shape is different. The terpenes inside of the plants are different. What are terpenes? This is what gives the smell. What makes cedar smell like cedar? Well, it's a highly volatile organic compound that is called a terpene that smells like cedar. Why does pine tree smells like pine tree? Well, it's apinine that you find in the pine tree that makes it smell like pine tree. So this is what it is. In the sativa, you have different terpene profiles than you do in the indica. One of the biggest difference in the indica, you have a high content of myrcene. Myrcene is a terpene that does have a medical effect like a lot of the terpenes do. And what it does, it actually opens up some of the little pores or little holes in that prevents everything from the blood to get through to the brain. It's called the blood-brain barrier. Protects your brain from many things because you could be infected. Your blood can get infected. You don't want to have a bacteria in your brain. That's called an encephalitis, or on the meninges, it's a meningitis. You don't want that. So that barrier has little holes that allows stuff to go through, or nutrients and everything else, including the cannabinoids. Myrcene binds to what we call a chloride voltage gated channel. As it binds to it, it opens up that little hole and allows the THC to get through to the brain faster. This is why the person is more affected in the central nervous system, being completely relaxed and being completely out of her if you're looking at the recreational side of things. And this is why it induces sleep on the medical side of things. Versus the sativa, you could have the same concentration of the THC in it, but since the content in myrcene is lower, it does not get through to the blood-brain barrier as quickly as it would with the indica. So you have a peripheral effect, because remember I told you THC binds to the CB1 receptor, but CB1 receptor is found mainly in the central nervous system, but you do have some on the peripheral nervous system.
And I think everything you just touched on, for those who are listening, it's very important that if you're wanting to try this kind of therapy, you just don't go to, Phil, who sells it on the corner, because you don't know what you're getting. If you have a condition, you want to see professionals such as François, have an appointment with him, go over all your health history and whatever else that you guys do, and then go from there and deal with a professional and not with someone who's selling it on the corner or walking into a dispensary that is still open. And I know here in Ottawa, they're getting shut down right, left, and center. But it's very important to seek out a professional if you are wanting to deal with this kind of therapy. Now, closing, how can people get a hold of you if they're suffering from some sort of disorder and are interested in learning more about cannabinoid therapy? Well,
first step would be feel free to send me an email. I'll give you guys my email. I'm going to have thousands of emails. So
I will put his email on this podcast. If you're listening,
be able to deal with them. No, I'm kidding. So my email is Francois@cccginternational.com. And our website is going to be up and running in the new year. We revamped a whole lot of things on it. One of the key components, and I keep on coming back to them, is the tailored treatment plans. It's based off milligrams of cannabinoids per day. So for us, as scientists, as healthcare practitioners, to prescribe in gram per days, when a physician prescribes in gram per days, it sounds a little bit like witchcraft. And the reason why, it's because It varies from product to product. This is why we need to have our trained cannabinoid educator, or to be quite honest, it doesn't matter to me where the person goes, as long as they have a follow-up, an appropriate follow-up, and as long as the information is passed along with the other healthcare practitioners involved in their care. This is what's so important. The primary care physician needs to know what the person is on, because as the health status of the patient or the client changes, then you need to know why, and you need to make modification. Yes, maybe we might be able to taper off certain medicines. Now we need to know. If the information is not passed down to them, then they will never know. But if you guys want to hear more about treatment plans, about the milligrams per days that we are currently using, translating them back into grams per days for the physician to prescribe them, feel free to reach out. We're there to help. And anyone that does suffer from any medical condition that they do believe that medical marijuana could help, ask. And don't be afraid to ask your family physician. Family physicians, might not feel comfortable prescribing it, but if they do understand a little bit about cannabinoid therapy, they will not, oppose themselves to it. And it's something that you guys need to understand. You're not allowed to abandon a client. You're not allowed to abandon a patient. So for someone to say, well, if you're going to be on medical marijuana, I can't see you anymore, that's illegal. Mm-hmm. It's immoral and it's illegal. And again, whenever you go see a specialist in cannabinoid therapy, if you have to pay anything out of pocket, ask yourself why. This is illegal and this is immoral again. In Canada, it goes against one of our 5 premises in healthcare, which is accessibility. No one should pay for healthcare in Canada, not under our current tax rate.
Yeah, absolutely.
We pay enough already.
Oh, yeah.
We're free of charge, and everyone should be free of charge. There is no such thing as charging extra because they're being prescribed medical marijuana or cannabinoid therapy. It doesn't make sense to me. It's immoral and it's illegal.
Yeah. So if you guys want to learn more, I will have all of François' information right on the podcast on the information. So if you have questions for him, email him. He is great to deal with, and his people have been great to deal with. And I've had personal interactions. And I won't name the family member, but there's a family member that has Crohn's and is doing phenomenal. So I actually want to put out a thank you to you, because you've actually helped that individual quite a lot. And
I'm glad to hear.
Yeah, it's personal standpoint. I've seen it help, a good chunk of people in my life. And that's why one of the reasons why I wanted to put out this podcast is to help educate people, because there is that stigma that we just talked about. And I want to kind of get rid of that and help educate more on the benefits of cannabinoid therapy. So thank you for coming on this podcast. Thank you for all of that information. I know some of it, some people might have been cross-eyed, but it's super important to get educated on the topic. And for those of you that are listening, please write a comment and share this podcast with people who need to understand a little bit more. And if you have questions, you can also leave that comment on here. If I can't answer it, I will be more than happy to forward it on to François. So thank you for listening to the Candid Savage podcast. Like it, share it, comment. And until next time, we're going to go get shit done. So thank you, François, for coming in.
Anytime, Ashley.
And hope to see you soon, actually.
Yeah, let's go for dinner.
Awesome.
Take care.
Have a good one, guys.
Do the same.